Thanks for watching AM Northwest. You know, more than half of men over 60 have an enlarged prostate, and that impacts their quality of life. But now there is a better way to treat it. Here to tell us more, we welcome from Providence Urology Clinic East, Dr. Nicholas Boncher. Good to have you with us.
Thank you.
Explain first of all what the prostate is and what it does.
The prostate, it's a walnut-sized gland, and as a gland, it means it produces something. So it produces some of the fluid for the semen that come out during sexual orgasm with men.
Right.
And so it's something that starts to grow at maturity when boys become men, and unfortunately, it keeps growing your whole life. And due to its position, it surrounds the urethra. So you can think of it like a donut, and the urethra goes through it. The urethra is a hose, so the hose is emptying the bladder. And as that prostate grows outwardly, there's really no impact. But as it grows inwardly, what you get is that hose gets crimped. And as a result, men have urinary symptoms. And
so that means frequent urination?
Yes.
So more often.
So more often.
Gets them up in the middle of the night.
Getting up at night, getting their spouse up at night,
right.
Or other people. As they get older, that getting up at night is a risk for them to fall. They get a slower stream.
Is it painful?
It can be if they really get to the edge of almost being closed off.
Right.
And at that extreme, they can go into urinary retention where they can't void at all, and then they're in the emergency department, and that's very painful.
Oh, wow, I've got to believe that. So you have a new treatment, and I would like you to tell me about that.
Yeah, so the way we used to treat, and still do to some degree, to treat this problem is either with medications to help relax that opening up, take some of the pressure off, or historically with a procedure called transurethral resection of the prostate, or TURP, which is to rotor-rooter out that overgrown tissue and reestablish that open channel. And those all have drawbacks. They have sexual side effects. They have low blood pressure and dizziness. They have prolonged recovery. They're really imperfect solutions. And so this new procedure called UroLift is great because it's very safe. The complication rate is less than 1%. It's easy, so it can be done in the office, and with the UroLift system, it takes about an hour start to finish before you walk into the office, you walk out, it's done.
Oh, that's fast.
It's super fast.
Yeah.
And most men don't have any catheter, and the recovery time is about a week or two. And so...
Okay, so it looks like a little wire.
It looks like a little wire.
All right. Well, first of all, yeah, tell us about this picture.
Yeah, so what you see on the left side there on that looks like an apple, that's the prostate, and that line down the middle is the urethra. And you can see how, it really is a crevice. It's sort of a slot canyon instead of a nice open tube. And on the right side is what you can see is this UroLift implant, which is actually squeezing or compressing each lobe, each side of the apple, and as a result, the channel down the middle opens up.
So it looks like you put 4 of them in.
Yep.
Is that usually the case?
Yeah,
then?
we always start with 4, sort of 2 near the bladder and 2 down towards the edge of the prostate. There are some guys who have really big prostates. We'll put in 6 or 8. But
wow.
the average number is 4, and each one is sort of customized to fit their prostate.
They look super tiny, from what I can tell.
Yeah.
And how long has this been around?
So this was FDA approved 5 years ago, and the original study is now matured out 5 years, and what we see is that those men who get benefit, which is most men, that durability is continuous. So here we are 5 years out from the original FDA approval, and those men are still doing great.
Oh, that's great. So there's no need for an update, right?
Yeah, there's no need for an update. Now, the caveat to that is that the prostate never stops growing, so there is going to be this retreatment rate with whatever you do. But for UroLift, it seems that retreatment rate is as good or better than all of our existing therapies.
Yeah, we were just taking a look at our flow director holding one of those, and they're just so teeny.
Yeah, it's nice, and it's not going to set off any metal detectors. People ask if this is going to react to their body, and it won't. It's an inert substance. It's just a suture.
Now, that is a good question. I did not think to ask that question. But that's a good one.
Yeah, and these are all realistic concerns, and I think it's important to sort of think about how does this impact people in the real life. And the nice thing is, you're not gonna take away from them. You're not gonna cause a worse problem, or it's this do no harm part of medicine. And they're gonna get better, and it's affordable. It's covered by their insurance, and they're not gonna be out of work for 6 weeks, and it's gonna get them back on their feet. It's a really nice thing.
And there's got to be a sense of freedom too.
Well, you know,
They've just got to feel better.
you hear about all these medical errors with medications, and if you're keeping people off of those medications or getting them off of them, so you're not going to have those issues, and folks are no longer tethered to home or the bathroom, or they go to the supermarket and they actually go to the store instead of going to the bathroom.
Yeah.
It's really nice.
Well, that is fantastic. I want to tell folks if they'd like to find out more, we'll put the information for you about Providence Urology Clinic East and the UroLift prostate procedure, 503-215-7628. We'll put all that info for you on our website at KATU.com. Doctor, thank you very much.